If you are over 60 and you've been told that your failing vision is just normal aging, that you need stronger glasses every year, or that expensive eye surgery is your only option to see clearly again, stop for a moment and listen carefully. I hear this frustration almost every week in my clinic. Doctor, my vision keeps getting worse. I can't read like I used to. Everything is blurry. Is there anything I can do, or do I just accept this? Just recently, a 69-year-old patient named Patricia asked me the same thing. She had been struggling with progressively blurry vision for 3 years, buying stronger reading glasses every 6 months, straining to read her medication bottles, unable to enjoy reading books, her lifelong passion, feeling her independence slipping away. What surprised her was this: her eye deterioration was not inevitable aging. It was caused by nutritional deficiency that a $2 oil could completely reverse. She was not being careless with her health. She was missing critical information that the eye care industry actively suppresses. New research shows that one very common vision care mistake, especially in adults over 60, can accelerate vision loss by years when simple intervention could restore clarity permanently. I'm Dr. Marcus Thompson, and in this video, I will explain that mistake, why the eye care industry has hidden this natural solution for decades, and a scientifically proven $2 oil that can restore blurry vision, reverse macular damage, and give you back the crystal clear eyesight you thought was gone forever. Before we dive in, drop a comment with your age and where you're watching from today. Have you been experiencing blurry vision, difficulty reading, or other vision problems that worry you? Write your answer below because your experience helps our entire community. And hit that subscribe button because I share suppressed health strategies like this every week to help you protect your vision and thrive after 60. Most people believe that vision loss after 60 is permanent and irreversible. They think once your eyes deteriorate, you need stronger glasses, invasive surgery, or you simply learn to live with impaired vision. But in adults over 60, that assumption is often completely wrong. Your eyes have a remarkable ability to heal and regenerate when given the right nutrients. Your retinal cells can repair damage. Your macula can recover function. Your lens can maintain clarity. Your tear film can restore quality. Without the right nutritional intervention, eye cells do deteriorate and die. That is why vision problems seem inevitable with aging. By the time serious blurry vision, difficulty reading, or loss of detail appears, significant damage may have already occurred to delicate eye structures. Here is the problem. As we age, our eyes become more vulnerable to oxidative stress, inflammation, and nutrient depletion. By the age of 60, more than 70% of adults experience some degree of vision decline. Our eye tissues have accumulated decades of exposure to UV radiation, blue light from screens, environmental toxins, poor circulation, and free radical damage. Each exposure increases the chance of retinal cells becoming damaged or dying. I saw this clearly with one of my patients named George, age 72. He had been an avid reader his entire life. Books were his escape. Newspapers were his morning ritual. Reading was his identity. His wife started noticing changes about 2 years before he came to see me. He held books farther and farther away to read them. He complained that the print seemed smaller and blurrier. He stopped reading the newspaper because the effort gave him headaches. He avoided driving at night because headlights created terrible glare. What most people do not realize is that early-stage macular degeneration and vision decline do not announce themselves with sudden blindness. They creep in gradually with subtle blurring. They steal contrast sensitivity first. They reduce your ability to see fine details. They impair your night vision. In older adults, waiting for obvious vision loss often means waiting until retinal damage has progressed beyond the easiest treatment window. This is why so many seniors discover serious eye disease late and face limited treatment options or even blindness. Now, here is where the first major mistake happens. Most seniors accept vision loss as inevitable aging and rely entirely on stronger prescription glasses. They assume deteriorating eyesight is just what happens when you get older. They think glasses are the only solution. They believe there's nothing they can do to actually heal their eyes. But in people over 60, this passive acceptance often leads to preventable blindness. Eye health requires nutritional intervention, not just stronger lenses. With age, the eye's protective mechanisms become less effective. Antioxidant levels in retinal tissue decrease. Blood flow to the macula reduces. The protective macular pigment layer thins. Oxidative damage accelerates. Without intervention, vision decline becomes a downward spiral. This is not rare. It is extremely common. That 69-year-old patient I mentioned earlier, Patricia, was accepting her blurry vision as normal aging. Same frustration every month, same stronger glasses every year, same feeling of helplessness. Yet her eyes were starving for specific nutrients they desperately needed to function. When we implemented the proper eye nutrition protocol, not just stronger prescriptions, her vision began improving within 8 weeks. Her blurriness decreased. Her reading ability returned. Her night vision improved. Her confidence came back. This is why targeted nutritional intervention matters just as much, if not more, than corrective lenses. If you're finding this helpful, go ahead and hit that like button. It really supports the channel and helps us reach more seniors who need this suppressed information. Now, let us talk about the first critical factor in vision restoration, and this one is extremely powerful but completely ignored by mainstream eye care. Factor number 1 is understanding oxidative stress in the retina and how it destroys your vision. If you look at most people's approach to eye health, they focus only on getting the right prescription glasses. They assume lens correction is the complete solution. They go to the eye doctor once a year for a new prescription. But chronic oxidative stress in your retinal tissue is silently killing the cells responsible for your vision every single day. Stronger glasses cannot overcome dying retinal cells. The retina is the light-sensitive tissue at the back of your eye. It contains photoreceptor cells called rods and cones that convert light into electrical signals your brain interprets as vision. The macula is the central part of your retina responsible for sharp, detailed central vision needed for reading, driving, and recognizing faces. These tissues have the highest metabolic rate and oxygen consumption of any tissue in your entire body. This creates massive amounts of free radicals and oxidative stress. Your retinal cells are literally burning up from the inside without adequate antioxidant protection. That oxidative damage requires addressing the root nutritional deficiencies, lack of specific carotenoids, omega-3 fatty acids, and fat-soluble vitamins. In adults over 60, protecting the retina from oxidative stress is the foundation of preventing and reversing vision loss. I saw this with a patient named Dorothy, aged 68. She had been diagnosed with early dry age-related macular degeneration 2 years prior. Her eye doctor told her to take a standard ARDS 2 vitamin formula and come back in 6 months. That was the extent of his advice. Despite taking the vitamins, her vision continued to worsen. She struggled with increasingly blurry central vision. Reading became exhausting. She couldn't see faces clearly anymore from more than a few feet away. Colors seemed washed out and dull. When we tested her blood levels of key eye protective nutrients, the deficiencies were shocking. Her lutein and zeaxanthin levels, the critical carotenoid antioxidants that protect the macula, were extremely low despite taking a supplement. Her omega-3 DHA, which makes up a huge portion of retinal structure, was severely deficient. Her vitamin A was suboptimal. Her vitamin E was low. Her zinc was borderline deficient. We addressed her oxidative stress and nutrient deficiencies through a comprehensive protocol, including the powerful $2 oil I'm about to reveal. Within 4 months, her vision improvements were measurable on clinical testing. Her visual acuity improved from 20/60 to 20/40. Her contrast sensitivity increased significantly. Her macular pigment optical density, a measure of macular health, increased by 28%. Her subjective experience was even more dramatic. She could read normal print again without straining. She could see her grandchildren's faces clearly. Colors looked vibrant again. Without addressing that underlying oxidative stress and nutritional deficiency, no amount of prescription changes or vitamins would have helped her. Research shows that people with low macular carotenoid levels have 5 times higher risk of developing age-related macular degeneration compared to those with optimal levels. Oxidative stress is not a minor factor. It is the primary driver of age-related vision loss. Another critical factor is understanding how inflammation destroys eye tissue. Chronic inflammation in the retina and choroid, the vascular layer feeding the retina, damages photoreceptor cells. It impairs the retinal pigment epithelium that supports photoreceptors. It promotes abnormal blood vessel growth that leaks and causes wet macular degeneration. It accelerates cataract formation in the lens. Inflammation comes from multiple sources: poor diet high in sugar and omega-6 oils, chronic high blood sugar damaging delicate retinal vessels, smoking that floods the body with inflammatory toxins, obesity that produces inflammatory molecules, high blood pressure that damages retinal vessels. All these factors create inflammatory damage in eye tissues. There is also a dangerous misunderstanding about vision care. Some people believe eye problems are entirely genetic and unavoidable. In reality, nutritional factors account for up to 70% of age-related vision loss risk. Diet, specific eye protective nutrients, lifestyle factors, and targeted supplementation can dramatically change your vision trajectory at any age. The key lesson here is simple. If you are over 60 and relying only on glasses for vision problems, you are missing the most important intervention. Nourishing your retinal cells and reducing oxidative stress provides real vision restoration that glasses can never achieve. Now we come to the second critical factor, and this one could save your sight. Factor number 2 is recognizing early vision loss warning signs that most people ignore or dismiss. Many people accept gradually worsening vision as normal aging. They think needing reading glasses is inevitable. They blame difficulty seeing on poor lighting. They ignore subtle changes until vision loss becomes severe. Early vision deterioration is your eye's way of crying for help before serious damage occurs. These signs appear months or years before obvious vision loss. Difficulty reading small print, even with reading glasses, indicates macular problems. Blurred or distorted central vision, especially straight lines appearing wavy, is a classic macular degeneration sign. Difficulty seeing in dim lighting or poor night vision suggests rod photoreceptor damage and vitamin A deficiency. Colors appearing washed out or less vibrant indicates macular pigment loss. Increased sensitivity to glare, especially from headlights or bright lights, suggests lens or corneal changes. Difficulty judging distances or seeing contrast clearly indicates retinal function decline. Needing brighter light for reading or close work shows decreased retinal sensitivity. Frequent changes in eyeglass prescription, needing stronger glasses every 6 to 12 months, indicates progressive deterioration. I saw this clearly with a 71-year-old patient named Harold. He had been experiencing subtle vision changes for over a year. He noticed straight lines, like door frames and window blinds, looked slightly wavy. He blamed it on his glasses needing adjustment. He had increased difficulty reading in restaurants even with his reading glasses. He assumed the lighting was just poor. Colors seemed duller than he remembered, but he thought maybe he was just getting old and everything seemed less vibrant. Harold mentioned these symptoms casually during a routine physical exam. I immediately recognized these as classic early macular degeneration signs and insisted he see an ophthalmologist immediately. The eye exam revealed early dry macular degeneration with drusen deposits under his retina. His macular pigment optical density was extremely low, indicating severe antioxidant depletion in his macula. Had Harold ignored these subtle symptoms for another year or two, his vision loss would have progressed much further and been harder to reverse. We immediately started aggressive nutritional intervention, including the powerful oil I'm about to reveal. 12 months later, Harold's macular drusen had decreased significantly. His vision had stabilized and actually improved slightly. His macular pigment density increased by 35%. He avoided what could have been progressive vision loss leading to legal blindness. Many seniors dismiss early warning signs because changes seem minor or gradual. A patient aged 73 ignored her difficulty seeing faces clearly for 2 years, thinking she just needed new glasses. It was advancing macular degeneration that eventually required expensive injections to prevent blindness. Early nutritional intervention could have prevented the progression entirely. The key principle is this: any vision changes that are new, progressive, or affecting your daily activities should be evaluated immediately and addressed nutritionally. Do not wait for vision loss to become severe. Eye damage is easiest to reverse when caught early with proper nutrition. Now we come to the third factor, and this is where everything changes. This is the suppressed secret the eye care industry doesn't want you to know. Factor number 3 is the specific $2 oil that restores vision by regenerating retinal tissue and reversing macular damage. For most seniors, Prescription glasses help compensate for vision loss. But there is one natural oil that goes far beyond symptom management. It actually rebuilds damaged retinal cells. It restores macular pigment density. It reverses oxidative damage. It improves photoreceptor function. It can restore vision that you thought was permanently lost. That oil is cod liver oil, specifically high-quality cod liver oil rich in vitamin A, vitamin D, and omega-3 DHA. This is not the refined fish oil you find at discount stores. This is traditional cod liver oil that has been used for centuries to prevent and reverse eye disease, now validated by modern scientific research. But here's what they don't want you to know. In the 1930s and 1940s, before modern ophthalmology became dominated by surgery and expensive treatments, cod liver oil was the standard recommendation for any vision problem. Doctors routinely prescribed it for night blindness, dry eyes, and early vision loss. It worked remarkably well. It was incredibly inexpensive. It prevented countless cases of blindness. But it couldn't be patented. As the medical industry became increasingly profit-driven, especially after World War II, the focus shifted to expensive interventions. Prescription glasses, cataract surgery, laser treatments, retinal injections, all highly profitable. Natural, inexpensive preventive nutrition was systematically removed from medical education and practiced. Maybe by the 1970s, ophthalmology residents were taught nothing about nutritional intervention for eye disease. They learned only about glasses, surgery, and pharmaceutical treatments. The remarkable vision-restoring power of cod liver oil was forgotten, dismissed as old wives' tales, or actively suppressed because it threatened the profitable eye care business model. For decades, this knowledge has been buried while millions have lost their vision unnecessarily. But the scientific evidence is overwhelming and undeniable. Cod liver oil contains 3 critical nutrients that work synergistically to protect and restore vision. Let me explain exactly how cod liver oil works in your eyes. First, vitamin A in the retinol form is absolutely essential for photoreceptor function. Your rod cells, responsible for night vision and peripheral vision, contain a protein called rhodopsin that requires vitamin A to function. Without adequate vitamin A, rhodopsin cannot regenerate after exposure to light. This causes night blindness and progressive vision loss. Cod liver oil provides highly bioavailable retinol that directly restores rhodopsin function. Studies show that even mild vitamin A deficiency impairs night vision and low-light vision significantly. Supplementation can restore this function within weeks. Second, vitamin D in cod liver oil is critical for retinal health in ways scientists are only beginning to understand. Vitamin D receptors are present throughout retinal tissue. Vitamin D reduces inflammation in the retina and choroid. It protects photoreceptor cells from death. It regulates immune function in eye tissues. It may even help prevent abnormal blood vessel growth in wet macular degeneration. Most seniors are severely deficient in vitamin D, and this deficiency directly contributes to vision loss. Third, and most importantly, omega-3 DHA makes up approximately 60% of the fatty acids in photoreceptor outer segments. DHA is literally the structural building block of your vision cells. It maintains photoreceptor membrane flexibility essential for light detection. It supports retinal cell survival and function. It powerfully reduces inflammation in retinal tissue. It improves blood flow to the retina and macula. Without adequate DHA, your retinal cells cannot function optimally no matter what else you do. Studies show that people with high dietary DHA intake have 30 to 50% lower risk of developing age-related macular degeneration. Supplementing omega-3 DHA can slow or even reverse early macular degeneration by nourishing starving retinal cells. The combination of these 3 nutrients in cod liver oil creates synergistic effects greater than any nutrient alone. Vitamin A enables photoreceptor function. Vitamin D reduces inflammation and protects cells. DHA provides the structural material cells need to regenerate.